Does wearing more than one mask at a time make you safer? You might have wondered that too if you were watching Monday Night Football last month and saw New England Patriots coach Bill Belichick wearing 2 masks after his quarterback Cam Newton tested positive for COVID-19. Well, let's think about that. Masks block contagious droplets that an infected person breathes out. They also offer a measure of protection for a wearer who's not infected. So yes, in theory, 2 is better than 1 and 3 is even better, says biosecurity expert Raina McIntyre, who researches mask effectiveness at the University of New South Wales in Sydney. But there are pitfalls to piling on masks. You may be more tempted to fiddle with the additional mask, and that's a bad idea if you're in a place where other people have been hanging out and possibly spreading contagious droplets. You might touch a contaminated surface, then bring the viral particles to your mask. And while a second or third mask will create a more effective barrier for outgoing and incoming particles, it will also make it harder to breathe in the air you need. Adding an additional mask isn't the only way to add a layer of protection. Dr. Abrar Karen, a physician at Brigham and Women's Hospital, recommends a multi-layered single mask that fits comfortably snug over your nose and mouth. Karen and other mask experts look for 2 or 3 layers in a mask. Some masks, for example, come with an interior pocket where you can insert a filter. So that adds up to 3 layers in one face covering. If you're still interested in doubling up, you might want to consider an innovative approach we wrote about a few months ago. As correspondent Maria Godoy reported, researchers at Northeastern University added an outer layer made from nylon stockings to a homemade face covering. They found that the nylon layer can boost a mask's ability to filter out small particles in the air by creating a tighter seal between the mask and the wearer's face. Using nylon stockings to improve the fit of a mask makes sense, says Lindsay Ma, a civil engineering professor at Virginia Tech who researches airborne transmission of infectious diseases. The stocking will help reduce or eliminate gaps that would otherwise allow particles to short-circuit the mask. Your mask helps protect those around you. COVID-19 spreads mainly from person to person through respiratory droplets. Respiratory droplets travel into the air when you cough, sneeze, talk, shout, or sing. These droplets can then land in the mouths or noses of people who are near you, or they may breathe these droplets in. Masks are a simple barrier to help prevent your respiratory droplets from reaching others. Studies show that masks reduce the spray of droplets when worn over the nose and mouth. You should wear a mask, even if you do not feel sick. This is because several studies have found that people with COVID-19 who never develop symptoms, asymptomatic, and those who are not yet showing symptoms, pre-symptomatic, can still spread the virus to other people. The main function of wearing a mask is to protect those around you, in case you are infected but not showing symptoms. It is especially important to wear a mask when you are unable to stay at least 6 feet apart from others, since COVID-19 spreads mainly among people who are in close contact with one another, within about 6 feet. Your mask offers some protection to you. A cloth mask also offers some protection to you too. How well it protects you from breathing in the virus likely depends on the fabrics used and how your mask is made, e.g. the type of fabric, the number of layers of fabric, how well the mask fits. CDC is currently studying these factors. Does mouthwash offer any benefit in reducing possible transmission of COVID-19? Imagine gargling the coronavirus away with minty fresh mouthwash. That's what some media headlines suggested in the past few weeks. The origin of this idea is a study published in September in the Journal of Medical Virology. Researchers at Pennsylvania State University grew the coronavirus in human liver cells, then flushed the cells with mouthwash for durations of 30 seconds and 1 and 2 minutes. Their finding, about 90% of the viruses treated with mouthwash lost their ability to infect cells. But that doesn't mean gargling is the next best thing to a vaccine. Here's what the optimistic media reports didn't point out. First, the researchers did not test mouthwash on the coronavirus that causes COVID-19. Instead, they tested the strain of coronavirus that causes the common cold. What's more, they did not test the impact of mouthwash on the coronavirus in actual humans, which makes the study limited, according to Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health in Weymouth, Mass. It's not a cure, agrees Drive. Craig Myers, the study's lead author, and it needs to be tested further on humans. In the study, mouthwash did not kill the virus, Myers says, rather, it temporarily stopped it from infecting more cells by killing the new copies it releases that are looking to infect other cells. The effects are local, so if they were to be replicated in human studies, he believes the mouthwash would only disable the virus that is present in your mouth at the moment of gargling. In other words, if you're not infected, gargling doesn't protect you from getting infected, says Myers. While in quarantine, however, an infected person can gargle as a precaution to protect the people around them. We're not asking people to do anything like inject this or do anything silly with mouthwash, says Myers. We see this as a layer of protection on top of wearing masks and social distancing. But even a really good long gargle is unlikely to get every bit of virus on each mucous membrane, says Dr. William Schaffner, an infectious disease professor at Vanderbilt University. Just wear a mask, Schaffner sighs. There is no magic solution, pun intended. Types of masks. Some masks work better to help stop the spread of COVID-19 outside of healthcare settings. Medical masks and N95 respirators should not be used because they should be conserved for healthcare workers. Cloth masks. The most effective fabrics for cloth masks are tightly woven fabrics, such as cotton and cotton blends. Breathable. 2 or 3 layers. Less effective fabrics for cloth masks are loosely woven fabrics, such as loose knit fabrics. Difficult to breathe through, like plastic or leather. Single layer. CDC is currently studying the effectiveness of various cloth mask materials. We will update this guidance as we learn more. Non-medical disposable masks. Disposable face masks are single-use masks. They are sold online and through large retail stores. These are not the same as surgical or other medical masks. You may prefer using disposable masks in situations where your mask is likely to get wet or dirty. As with cloth masks, make sure your disposable mask fits close to your face without large side gaps and completely covers your nose and mouth. Bring extra disposable masks with you in case you need to change out a dirty or wet mask.